And we've talked about local metabolism is very, very important for various hormones. We talked that for testosterone, where if you have aromatase, it will produce estrogen. If you have 5-alpha reductase, it will produce DHT. We talked about cortisol. If you have 11-beta HSD2, it will inactivate it. If you have 11-beta HSD1, it will activate it. Same here, local metabolism is very, very important. And from, as we said, thyroxine is a prodrug. It can be converted either into the active T3 or the inactive reverse T3. And there are specific monodeiodinase. So it's very simple. 4-iodine, remove 1, that is monodeiodinase. The DIO1 and 2, they are basically converting the T4 to an active form, which is T3. And DIO3 is mainly inactivating it into RT3. So the balance between these enzymes will decide about whether you are hypothyroid or hyperthyroid. So what will happen in hypothyroidism? Which enzyme should be activated?
So in hypothyroidism, FT4 is low. So this MDI1, which converts this FT4 is converted to F3. This activity is increased.
So you want DIO or MDI1 and 2 activity to be more. And you want less activity of DIO3 or MDI3 in that regards. Now, further metabolism of these compounds is again done by these enzymes. We won't go much into detail. But if you remember, if you want more thyroid in the blood, have DIO1. You want more thyroid in the brain, use DIO2. You want less thyroid in the body, you will go for DIO3. So which conditions you will want less thyroid in the body? You are happy that, okay, my thyroid, I don't want thyroid to be more, it may cause more harm.
So in case of any cardiac problems,
any illnesses. Yes. If you are sick, in sick, you don't want to fight that, you don't want to waste your energy by increasing your temperature in that regards. So in anybody who has got a sick state admitted in the ICU, your MDI3 or a DIO3 activity will go up. So what will happen in that setting is that your circulating thyroid hormone will be less. The second stage, one is sickness, second is same, that is the same, critical illness, whatever you want to say. Anything else? Which state in the body doesn't want to waste energy, wants to grow? Fetus. So fetal state is also a hypothyroid state. So in the fetus also, your inactivating enzymes are acting more, activating are going down. This is what we'll discuss much more in detail. So these enzyme activities will determine a lot in that regards, in that perspective. So as discussed, there are 3 major enzymes which convert T4. We have got DIO1, which is monodeiodinase 1, which is mainly there in the periphery. So liver is the major one which will determine the circulatory thyroid. Liver, kidney and thyroid converted to T3. Now there's one other way of this T3 is sulfated. So now it's sulfated, it is a fixed deposit. You can't use it immediately. So this T3 sulfate will become inactive. This is important in a fetal perspective, not beyond that. Now this T4 can also be acted by DIO3 to reverse T3, which is inactivation. And this happens in placenta. Now why placenta? You don't want mother's T4 to really rush into the baby. In the fetus, skin and uterus. So this is what we discussed about. Fetus, we don't want too much of these activities to go from there. And also in some areas of the brain. There is also a mechanism within the brain of DIO2 or MDI2, which converts T4 to T3. This is mainly in the areas in which thyroid has to work, like brain, pituitary, brown adipose tissue, and muscle. So why do we have 2 systems of DIO1 and 2 rather than 1? So we've got one which is inactivating, which is DIO3. There are 2 which are activating, and they are differentially expressed.
So, like we have said, in systemic illness or in the fetus condition, the thyroid, this T4 will be decreased, but brain has to grow and this pituitary has to work. So this DIO2 will start working. So T4.
So the very important part to remember is that there are 2 activating enzymes. One for the blood, one for the body, the second for the brain. So in situations you want the body to not be exposed to thyrotoxic state, but brain should be preserved, your DIO2 will go up. This is sickness and this is in the fetal period. Now, if your DiO2 goes up, what will happen to TSH?
It will be decreased.
Decreased. So in somebody who has a critical illness, first thing, what will happen to TSH?
That will be normal decreased.
Decreased. What will happen to T4?
The T4 levels will be low.
Normal or low. What will happen to T3?
So T3 will be high, sir, not be normal, please.
Decrease, na? Your MDI3 is working more, na? DiO3. So in illness, you are converting your active to inactive form. So your T3 is going very low. So circulating T3 will be low. T4 may be normal or low normal, but your TSH is also low. So then you will make a diagnosis of central hypothyroidism, which is a confusing state. So don't make an unnecessary thyroid function in a sick state. Once it recovers, now your MDI2 or DiO2 activity has come down. What will happen to TSH? So the illness has recovered, baby is better. What will happen to TSH? It will increase because it was suppressed and now it will rebound. Now you will diagnose it as subclinical hypothyroidism. So again, this is a normal response. This triphasic response, you can say, first central hypothyroidism like, then subclinical hypothyroidism like, and then normal. So this is something which is important to remember. So don't do functions in a critically ill child in that scenario. Now, so if we talk about the enzymes, DIO1 or MDI1 is basically acting on both outer and inner ring. It acts mainly for the circulation, liver, kidney, and thyroid. It is stimulated via T4. DIO2 is mainly for the brain, pituitary, retina, all those vital areas. So that also is important. Otherwise temperature will go down. So now you remember very clearly that you have other metabolism of thyroid is going down, growth, all those effects are gone. But you're preserving the temperature. You don't want the temperature to fall down. That's why brain, pituitary, bat, and retina, critical areas, it is working like a action is going on. And DIO3 is mainly in placenta. You don't want too much mothers coming in, fetus, and some areas of brain you don't want overexposure. That's why it is working. So the balance in thyroid hormone is basically achieved via activation or inactivation. So activation means T3, inactivations means RT3, and this balance is mediated via DIO1 or monodiiodinase 1, which causes activation, and it is suppressed via MDI3 or DIO3, which causes inactivation in that perspective. So this is how it is important. So the acute regulation of thyroid function is largely at the level of local enzymes.